Fortune Talk Show. As you all know, my name is Fatima Yakub, your host, and today we have the medical topic to talk about, and I'm sure you're going to like it. And I also have a very wonderful guest in the house, but before then, I want you to subscribe to our YouTube channel if you have not done so. Subscribe and hit the notification bell so you'll be the first to know when we upload new videos. Once again, I welcome you on board. I am Fatima Yakub, and on no return from the break, I'm going to tell you who my guest is. Guest in the house today. His name is Dr. Sam Alhassan, a medical officer, University Health Services, Federal University, Lokoja. I want to welcome him to this show, and I'm sure you're going to enjoy every bit of this edition. Thank you once again. And right now we're meeting our guest. You're welcome, Dr. Hassan.
Thank you very much.
Yeah. Haven't introduced you. Please, can you briefly tell our people who you are? They want to meet you too.
Just like you've introduced, my name is Dr. Sam Alhassan. I work with the University Health Services, Federal University, Lokoja.
We are pleased to meet you, and we're also pleased to have you here today.
Thank you very much.
Yeah, the topic, quickly, won't take much of your time. We're looking at heart diseases and stroke, especially in among young people. You know, before now, we talk about stroke, happening to elderly people or something, but now you see that it is actually happening to young people. What are the causes? What are the prevention? And what is the cure? You want to briefly look at these three.
Okay. Looking at stroke. Stroke in the young, stroke in the general population. Stroke is a sickness that's primarily from the nerves. But what is causing it is shortage of blood to the brain. Okay. And because of this shortage of blood, nutrients and oxygen is deprived to the brain. Because of this, the brain tissues start dying, and all the deficiencies that follow, they begin to manifest. So how does it happen? In two ways. One is that the arteries supplying blood to the brain can be blocked. Okay. We call that ischemic. The other one is that they can burst, and then the blood leaks into the brain. We call that hemorrhagic. That may be temporary. In some people, you see the leg and the hands lose their function. Then momentarily, within 24 hours, it returns. We call that, as people will call it, mini stroke, partial stroke, or transient ischemic accident. That resolves. But the one that persists above 24 hours is known as stroke, completed stroke. Now, what are the causes of stroke? You have agreed with me that stroke is one of the heart diseases. But among medical specialties today, stroke coming from hypertension, which we can say three organs are responsible: the heart, the brain, and the kidneys. So the problems that might come out of this will be taken care of, likely by the specialist. Okay. But since stroke is more of a nervous problem, it's usually taken care of by the neurologist. So how does the stroke come about? This is what we talked about. Suddenly it happens. Unfortunately, we live in a world where they put so many explanations to it. Some say it's witches and wizards. But I want to tell you the causes. The commonest cause in the world where we live today is hypertension. The blood pressure flowing at a very high rate. And hypertension is defined as, is seen as a silent killer because there may be no signs. And suddenly the first time some people discover they are having a stroke. Other heart diseases could cause a stroke. Then, diabetes is next in line. It could also result in stroke.
Okay, sorry to bring you back. You talked about other heart diseases that could cause stroke. Can you give us some examples of
coronary heart disease, okay. Coronary artery disease. That is a supply, the arteries that bring blood to the heart. Okay. The heart itself brings blood to the whole body, but there are also vessels that bring blood to the heart. If they have a problem, it will result in a primary heart problem, later resulting in a stroke. Okay. When patients have a heart failure, the blood does not move as it should be. It's sluggish. Any activity that makes the blood to form thrombus, it forms clots. Because when blood is flowing slowly, it can form clots, form blockages, and that can block, eventually seep into the arteries in the brain, blocks them, eventually resulting in a stroke. So heart problems can eventually result in causing a stroke. And then I mentioned diabetes, sedentary life leading to obesity. So people who are obese, people who are well built, if they live a sedentary life, they don't exercise, they could have stroke. Tobacco smoking or in any form may result in a stroke too.
Wow.
You look at age, stroke can happen in any age. In newborns, it could happen. It could happen in adulthood. But as from 55 years and above, in every decade, the chances of getting a stroke increases. That's why we say stroke is more in the elderly. Then when you look at racial distribution too, among the blacks, it is commoner.
Why?
One of the reasons is, first of all, the blacks were not, they didn't westernize. But so to say, let's say our education did not take us to the level where we will be able to check ourselves, one. Then secondly, our kind of development is such that we are still in the theological and metaphysical. We have not moved to that scientific. So we link most causes of diseases to other things than going medical.
Okay.
And so we will not be able to come out. And then understanding of the disease process itself is a problem. Like I mentioned, hypertension being one of the causes. People will have headaches, they'll have body pains, they'll feel that their heart is beating faster. Rather than even do a BP check and start antihypertensives, they will rather be treating malaria and typhoid. And when they are diagnosed to have high hypertension, they think that they have treated it and it has gone. Little did they know that it's supposed to be a lifelong treatment. When they continue, suddenly they will collapse and have a stroke. Then again, things like sickle cell disease is commoner in the black population and is also a cause of stroke. So if you add up this, strokes may be more in the black population. Stroke is found to be more in the males than in the females.
Than the female. Why?
Because of the risk factors that the males face.
Really?
Just research shows that it is more. But if you talk about more, we say that men are likely to face stress. If you begin to talk about this, it's arguable anyway. So can we just leave it that research?
I feel that the stress we're talking about, both male and female face a whole lot of stress these days. I won't say female face more stress than the male. The male might be talking about physical stress, going out, trying to think of taking care of the family and all that. But the female, they go through a whole lot of stress, emotional stress, physical stress, and all of that. And nothing kills a being more than the emotional stress.
In as much as I'm not going to argue about that, I want to let you know that if you look around, from the stories you heard, from the records you had, how many men have had stroke than women?
But
you would
women
have seen that men have. Women do have.
Oh, yeah.
Men also do have.
But
records shows that the men have had more. So we are saying the risk factor is more for men than women.
Well, I won't go into that argument for now because of our time. Yes, so just go on a very short break, and when we come back, we're looking at the preventions and the cure for heart diseases and stroke. Once again, I am Fatima Yakub. If you have not subscribed to our channel, please you have to do so right now. Subscribe and hit the like button if this video is making any sense to you, and hit the hit the notification bell so you'll be the first to know when we upload new videos. I still have Dr. Sam Alhassan in the house. Thank you. We'll be right back. Talk show, and my name is still Fatima Yakub. Okay. All right, we'll go straight to the prevention of these heart diseases, especially stroke, looking at how it's becoming too common among people, especially the youths. So we still have Dr. Sam Hassan in the house. Thank you, Dr. Hassan. Now we're going to look at the prevention.
The prevention of a thing usually will have to do with understanding the causes. So if you know the causes, then you can attempt to prevent. Again, accepting the illness. Because if we keep dodging the causes, we may never be able to make efforts to prevent. So one of the first things I mentioned there It's I talked about hypertension, but before even going to these causes, one of the ways to prevent is what you are doing: health education. The society needs to understand that these diseases exist and that there are causes for this. I can tell you that there are places where stroke happen and people still think that the ancestors are visited.
Village people.
Yes, if you make those assumptions, then you can never really get the treatment. There are times when people have had stroke, and one of the first treatments we give in the hospital is see, the person must not eat anything, must not swallow, because we don't know if the swallowing mechanism has been affected. But before you know, people are already feeding, and eventually they may end up killing those kind of patients. So the people need to understand about the disease, the causes, the process of the disease happening, and how it can be prevented. Prevention can be looked at in two phases, to make it very simple. One of it is at the primary level, that you try not to even get the disease.
Exactly.
Next is, if it has happened, how do you now manage the disease and limit disability or damages? If the damages have happened, how do you rehabilitate? How do you bring these people to fit into the society? So now somebody does not have a stroke, so let us ensure that you do not have hypertension. One of the causes I didn't talk about is that stroke can also run in families. Some families, I just know that people from this family get strokes. So we say it runs in family. So if you find out that one or two persons have had a stroke in your family, it is fine to put yourself, to go for medical checkup.
And that's where
find out the causes.
In, right?
Yes. So you find out the causes. So one of them could be hypertension. Does the person have, you keep checking your BP. If it's diagnosed, start treatment on time. Is the person well built? Is it obese? Of course, you need to do exercise. You need to go into dietary restrictions so that you'll be fit and you are not carrying a weight that is too much for your height. The person involved in alcohol, you have to reduce it to the barest minimum. Too much of it actually is said to affect hypertension and to also lead to stroke. Tobacco smoking should be called off completely. So smoking cigarette or chewing or all those things have to be stopped. If there is diabetes, it should be controlled as well.
Okay.
So then if there's any underlying heart disease, like we mentioned before, you should go for treatment. The key thing here is that one needs to go for a medical checkup. And if there is an underlying
you don't really have to wait until you're sick or something.
People don't have to. We are poor in doing that in this country.
Yeah.
But that's the way forward. You don't have to go to hospital only in the face of sicknesses. You should go for medical checkups.
That's Dr. Sam Hassan you're still listening to. And quickly, before we go, Dr. Hassan, can you tell us if there is a permanent cure for heart diseases and stroke?
It depends on the level. Heart diseases, if you want to go into heart diseases, is a whole very big complex thing. Sometimes there are those ones that are congenital. Okay. The child is born and is coming up with a disease. Some of them are correctable. Okay. If they are corrected, it is permanent. Then there are some that you hear of a hole in the heart. Yeah. As the children grow, that hole closes. It's permanently cured. But there are those ones that need intervention. They can also be cured. But there are those ones that you really can't do much about. You observe. Okay. And then you just try to manage. And you see when they go to see the pediatrician, what they aim to do is that they don't get chest infections. They don't get any infection that can tamper with it and worsen it. And they are managed throughout childhood. They are kept in check. For the other ones, like hypertension, if it is primary, you just have to manage it for the rest of your life. When I mean primary, that one is getting older, the bodily changes are bringing about the hypertension. But secondary hypertension, like the one that happens in pregnancy, the woman is normal, she gets pregnant and the BP goes high. Some of them deliver and it's resolved. Some of them take BP drugs for just up to 6 weeks after delivery and it's finally okay. Somebody gets a very terrible news or is involved in emotional trauma that results in the blood pressure going very high. Those kind of people, they take drugs for some time and it goes down.
Okay.
So that is secondary. But if it is not secondary, primarily it deteriorated, the BP is going high, they will remain on drugs.
Now let's talk some of them, about stroke precisely. Is there a cure for stroke?
We have heard
because some people, their belief is that if it happens to a young person, it can easily be cured or be taken care of. But if it's an old person, it's not as easy as that. They may have to live with it for the rest of their lives.
The statement is true.
Okay.
The findings have shown that stroke in the young people, most times, many of them recover 100%. The reason is because stroke, like I said, primarily affect the nerves. Nerve regeneration in younger people is faster. In the old people, the nerves are almost not growing, so slowly growing. So it takes them time to recover before the speech comes, before you can even see a flicker of movement. It's taking time. So at best, you want to get these people to be fully okay upstairs, recognizing people, sitting to gist, and then attempting to move the lips. Some of them will be undergoing this recovery, and they may never fully recover till they die. But a good percentage of young people have fully recovered and go back to their normal jobs.
All right, thank you so much for your time, Dr. Sam Hassan. Our viewers, thank you so much for staying with us. You have just listened to Dr. Sam Hassan. You know, he has actually enlightened us about some heart diseases and especially stroke, the causes, the prevention, and the possible cure. I am still Fatima Yakub and still watching Fortune Talk Show. Quickly, before we go, Dr. Sam Hassan will have to give us, our viewers, an advice. Because they need to hear one or two things from you. You know, you might be saving a life.
Well, it all begins with education. So, medical checkup is very important. And some things we think we are enjoying may be harmful. Stop smoking, stop taking excess alcohol, go for medical checkups. Thank you very much.
All right, thank you very much. I hope you enjoyed every bit of this edition. My name is still Fatima Yakub, and we'll come your way again with another beautiful topic. Once again, I say thank you. Don't forget to subscribe to our channel, Fortune Talk Show, and hit the notification bell so you'll be the first to know when we upload new videos. Don't forget to like our videos. Thank you. Bye.